Damien Green, to have a chat around the direction for e-health. Thank you, Damien.
Thank you, Dallas. One of the things that COVID-19 has taught us is to be very agile, and it was very impressive seeing the seamless way the teams managed the back-end technical issues to support this presentation. So thank you for your time today. It's a wonderful opportunity for me to be able to connect via technology with partners in technology for eHealth Queensland, and I'm very conscious that this is one of the first engagements I've had with industry in this role, and I sincerely appreciate the opportunity that's been provided by the team and Chris's team to give you this COVID-19 update from Queensland Health. Have I got a slide? Thank you. Yeah, I might do that. So, those who know me will know that I often like to start about our a conversation about our core business, which is really about patients and clinicians and the context in which they work. And one of the key challenges that I see in Queensland Health, particularly in eHealth Queensland, is connecting our team, that's eHealth Queensland, with the work of our clinicians and the context in which they work and the changing world in which they're operating. Not only are clinicians confronted by a relentless demand for care in the hospital system, we're also confronted by new and technology platforms that clinicians want to harness quickly in an agile manner, but we're also confronted with rising morbidity and mortality in Australia, particularly in elderly and frail cohorts of the population. And there's an increased pressure on the health system to respond and provide better care to those groups of people. So there's a real opportunity in terms of our digital agenda to harness digital to ensure that we're actually driving better outcomes for clinicians and patients. And for me, that's what the digital transformation agenda is about. It always starts with the clinician and patient in the centre, the context in which they operate, and connecting digital technologies to think about the new use cases that we can explore to drive better care outcomes for the Queensland population. And that does challenge the traditional way that we've been thinking in healthcare, particularly in terms of the way we've designed ICT portfolios historically and where we need to get to. And this is why. On the screen in front of me, you can see the range of healthcare technologies that are confronting us today. New technologies, and often with these technologies, and you'll know this, they come with a lot of hype. Latent expectation around the possibilities of what the technology offering could present to the health system and the opportunity to transform the way we provide care. And our challenge in the health system is often to read through this and to try and identify when these technologies might land and mature and make a real difference, when we'll be able to mainstream them. And we regularly go through a process within our team and with our partners to have conversations about these technologies and understand where they might fit in our portfolio. And this work is really important because I guess at the front end of our picture is we've got to make sure that IT is always supporting our business agenda. And so the question I'm always asking in terms of a technology opportunity or offering is how it drives our business forward, how it drives better outcomes for the health system, whether it's promoting wellbeing, where it's improving the reliability of the healthcare that we deliver, whether it's enabling us to work with our partners more effectively, or it's supporting us to do new and different things. And that's great, but we also have a problem in Queensland Health, and that is we've got to support a very diverse and disparate healthcare system. And just this map that's on the screen shows some of the divide that is beginning to exist in Queensland just because of the existing digital investment we've done. And that is, we've got focused a significant amount of investment in the southeast corner, and now the opportunity is open to us to expand the digital agenda into regional and remote Queensland. And I guess if there's one key signal that I'd like to send is that's a signal I'd like to send today, particularly in relation to our COVID response. This is a key priority area for us in Queensland Health. Getting the digital foundations right so that regional and remote Queensland have an opportunity to participate and contribute to this digital transformation agenda. So many of you will know our digital strategy that we've invested in, and that's been on track since 2017, and we're constantly investing in each of these horizons. It's not a linear relationship. We're building our foundations, and through the foundations that we lay, we're optimising our systems of record, building the data sets so that we can create great clinical decision support solutions, and then optimising our care, and then using those solutions to get into the field of play that we really want to play in: precision medicine, genomics, artificial intelligence, the things that will really transform healthcare. So that picture is in the back of our mind, but for COVID we had to think quite differently, and I want to talk to you today about some of that story. I'll take you back to that map that I introduced right at the beginning of all the array of technologies that confronted us. And many of you will know all those range of technology offerings that are available to us today, because many of you have written in and offered those as potential solutions through the COVID-19. And right from the start of this pandemic, right from early January, when we saw what was happening in China, we realised that this was going to grow into a pandemic and it would need a planned system, an agile but planned system response from Queensland Health. We began to think about the question around how we could leverage some of these new technologies to deliver a more agile and responsive IT system to support our clinicians manage COVID. And there was a number of strategies that we've implemented to drive that. The first was optimising our digital platforms that we've been investing in to date, and to think about how we could use agile approaches to manage optimising those platforms, particularly around ensuring that we were scaling them to be able to handle the volume of transactions that we knew were going to grow on those platforms, whether it be our existing telehealth infrastructure or it be our workforce who are enacting business continuity plans and working from disparate locations, or be our clinicians looking at new ways to invest in virtual technologies and platforms so they could continue the core business of providing care, albeit not in the hospital setting. So optimising our digital platforms and scaling our infrastructure to be able to support that has been our number one priority in terms of our COVID response. And I'm pleased to say, based on the journey that we've gone through, we took an agile and incremental approach to do that, always reading our capacity and comparing that to utilisation and scaling that where appropriate. And there's a number of partners who worked with us to do that, particularly using the agile procurement techniques that Dallas and his team have been deploying to assist us get that response out. And I'd like to thank those partners who've been working with us. So in addition to scaling our digital platforms to ensure that we could operate in that context, we also spent a significant amount of time looking at our core systems of record and thinking about how we could implement in an agile way changes to support clinicians manage COVID. Simple things like what will we need to do to optimise the electronic medical record that we've deployed in our digital hospitals, so that clinicians could effectively diagnose and treat COVID in the time frame that's required without putting the rest of the hospital service at risk. And that was critical in terms of thinking about how we planned the order sets, how we deployed results alerts, and how we managed communication with GPs, etc., and consumers around introducing automated SMS alert systems. And in addition to that, we have a number of critical care systems that operate in our hospitals that we also needed to think about in order to scale the response. An example would be our ICU systems. Back in January, when we were looking at what was happening in China, we could see the tremendous demand that was occurring in China's ICUs, intensive care units, because they hadn't implemented, because it was new, an agile response to scaling ICU capacity, and that caused them real problems operationally on the ground. So we got in early and used the time in January to begin to scale the capacity of our MetaVision solution and other solutions such as our emergency care solutions, so that we could handle and support our clinicians working in a remote, using those solutions in a remote environment. And in addition to that, there were new use cases that we hadn't ever invested in before. For instance, we quite quickly realised that one of the biggest risks to Queensland was the arrivals from coming in from China, or the school kids who were in China on study tours who were going to need to come back or being sent back from Wuhan. And quite quickly we realised we didn't have a system to quickly identify, screen and work out who needed to be isolated and quarantined, and do that in such a way that we could scale those technologies to support our clinicians who we had to quickly deploy into those airports or into those arrival ports. And so implementing agile solutions to develop an app with our clinicians so that we could agilely respond on the ground to that solution and deliver that successfully over the January period before the peak hit was critical to our response. And again, I'd like to acknowledge the efforts of our hospital and health services who partnered with us in that work. And critical to that was the work of our procurement teams and our suppliers who worked with that on this issue. Right from the start, the shortages hit in terms of our ability to scale infrastructure, our ability to get in and get the equipment to enable us to scale our supply. And our procurement teams and our suppliers were fantastic in working with us to mobilise the equipment necessary to deploy that response across the Queensland. And I'm delighted to say that as I've been monitoring our daily response to COVID, all our metrics in terms of ICT performance and delivery have been green. And it's in no small part due to the work of our suppliers and those who have engaged with us to scale our response to achieve that response. And based on the customer feedback that I receive on a daily basis in the bridges that we've been running with our hospital and health services, I'm getting good feedback in relation to that. Now, thinking about COVID, and we had to implement social distancing, all our workforce, our 90,000 plus people, have to provide care, but also comply with the same social distancing requirements that we've implemented in any workplace. So workforce mobility and constructing our business continuity plans to incorporate workforce mobility concepts were actually a critical part of our response. So you can see on the screen all the things that we've needed to work through in our organisation to be able to respond and enable our workforce to provide care in a virtual capacity. And one of the things, I won't go through all the statistics, but one of the key things that has been the benefit of COVID, if you can see a benefit in what has been a terrible pandemic, is that the way our clinicians have solved problems and through the embrace of digital technologies. For instance, our regular users on a daily basis of Microsoft Teams now counts, we have around 50,000 regular users in Queensland Health using Teams, whether it be for business purposes or clinical care purposes. And that's because our clinicians have confronted the challenge of COVID and thought about what's a different way that we can begin to work to provide care. An example would be our vulnerable communities in regional remote Queensland. They might have an existing chronic disease that requires treatment, but they're locked down. They can't necessarily get out, particularly if they're living in an Aboriginal and Torres Strait Island. So our clinicians have been using Teams technology, something that we never thought we could do in a virtual care capacity. And so this has opened up a new world of opportunity for us about thinking about using coverage to think about what's the new normal in Queensland Health. How are we going to continue the agile thinking and the deployment of solutions to enhance the way we're engaging with our communities? How are we going to continue using Teams to engage with those chronic disease patients who haven't been seeking treatment because they're worried about coming into a hospital? How can we actually, instead of pulling the patient into our hospital, reach out and engage the patient in their home? And so COVID, despite all its challenges it's prevented, has created some significant and new opportunities for Queensland Health and our partners in terms of beginning to think about how we can transform the delivery of healthcare. There are new models of care open to us, particularly in terms of the way we think about non-admitted care, the way we provide outpatients, instead of bringing the GP making a referral when you're going onto a wait list to come and see a specialist in 12 months, 24 months or 36 months. We can actually deploy new models of care where the GP consults with the specialist in the room with the patient in front of them. And this is the value that comes with telehealth and telemedicine. In the acute setting, we can use remote monitoring technologies to begin to monitor those chronic disease patients, those people that are high risk of needing a hospital presentation, so that we're monitoring their vitals and intervening in the home to ensure that they're getting the care that we've needed. And we've already seen emergency departments begin to think about what the future role of the emergency department will be in a virtual sense, particularly in terms of engaging with those vulnerable communities who are potentially frequent flyers in the hospital setting, and actually beginning to think about how we can deploy emergency care in the home. And right across hospital and health services, we've seen hospitals set up virtual wards and virtual clinics so they can keep the core business of care ticking over and running. And all of these solutions are underpinned by a well-defined problem that's set by, or challenge set by our clinicians, who then engage with eHealth Queensland and the partners that we work alongside, that's the IT industry, to spin up agile prototypes which we then mainstream and scale to solve that problem. And so that agile mindset, that delivery, that problem-based focus in terms of transforming healthcare is something that momentum that we really want to keep post-COVID, and it's something that I want to do as the Deputy Director General of eHealth Queensland do with you, and engaging you in conversation, which is why forums like this are so important to Queensland Health. There's so much opportunity coming out of COVID that will become the new normal in Queensland Health. There will be issues and challenges in relation to the continuing challenge that we have of living with COVID in the community, how we begin to scale the delivery of outpatients care via virtual means, how we begin to manage working alongside our other partners in government to manage the digital identity, and how we begin to increase the work that we're doing with various clinical teams and the clinical networks to think about new clinical pathways and new ways to deliver care in Queensland Health. As you can see from me, I'm pretty excited about the opportunities that have been opened up, but I'm more excited about the new opportunities that are developing for us to partner with you, with industry, to create a new and transform healthcare delivery in Queensland. But I want to bring you back to this picture, which is what I started with. Queensland Health is a big state. We've focused to date on setting up the digital foundation, and particularly in terms of moving from paper to the digital world in our key digital centres, our referral centres, which are our key digital hospitals. But now we're moving into the next phase. Now we want to extend the digital agenda into regional and remote Queensland. There's a lot of untapped capacity, and this again requires partnership with industry, particularly telecommunications providers, because if we do this successfully, we're not going to be able to scale the digital health agenda without reliable telecommunications infrastructure across the state. We can't afford to continue to have the outages that we've been having, where through sudden and heavy downpour of rain, community can be without its mobile telephony for 6 weeks, and that's happening today. And that's something that we've got to work together to change. The opportunity for us is to explore how the digital health agenda can be transformed to support the delivery of healthcare and extend it to the rural and remote agenda, and that's where we're moving to next from a Queensland Health perspective. So I'll pause there. I hope I've whetted you with the appetite with both how we've responded to COVID, but also laid a picture of the future opportunities to come. Thank you.
Thanks, Damien. That's been some fantastic insights into what's happening in Queensland Health, particularly for e-health. And I think there's a couple of themes that resonate, I think, for lots of people in government and probably industry as well, that comes from that presentation. So those challenges in terms of the digital infrastructure, particularly in terms of telecommunications out to remote and regional communities, is not just health, but it's other challenges for government service delivery. And Damien spoke about in terms of the response to COVID for e-health and how they have to scale very rapidly. And I think that's a common theme across a lot of agencies in Queensland Government, is the need to scale very quickly, to do things that normally might have taken weeks and months to do, were done in days in a very short space of time. And Damien also sort of talked about collaboration and using some of those collaboration tools. And I think that has been a story that's not just in government, but as we engage with our partners, I think it's been something that's happened nationwide and internationally as well. An interesting stat there that Damien talked about in terms of the use of Teams, for example, the 266% increase in usage. So I'm told within my own agency that's been 1,200% increase, and it may just reflect that knowledge workers as you have and the likes of and clinicians in Queensland Health are already well advanced in using those tools, and perhaps we weren't quite using that. But I think again that's a strong story that we've seen there. And I guess the other theme out there as well, I think most people would kind of acknowledge, is the change and the need to change to those new delivery models. Or I think, Damien, you talked about care models, and I think that's very much the case. And across government, I think also our industry partners as well. So some really good, I think, themes out of there. And again, thank you very much for a very informative presentation. Now, for the folk on the line, I understand that during this webcast, there's been a number of technical issues in terms of audio. But can I reassure you that the recording won't have those same issues. So if you weren't able to hear some of Damien's presentation initially, so if you go to the link later on, you'll be able to access the presentation and the webcast without some of those technical issues, I believe. So with that, I'm going to hand across to Mark, and Mark is moderating the questions that some of you have put online. So Mark, over to you.
Thanks, Dallas, and thanks, Damien. Look, and apologies again for the technical difficulties that we've had. What we do after the end of every session is we actually do a key questions and answers, and we also include the slides and everything from the presentation. So all we can do is apologise, and if you have a question that you'd like to ask, perhaps it was because you couldn't hear it or anything, please shoot the questions through now via the web form that's in front of you. There's a little dialogue box down the bottom which you can submit questions. So I will jump into the first question, as we have had a couple come through. One cheeky question, Dallas, about offering help with technology, but we'll just skip that one for the moment. There's a question here about 3D printing, Damien, and it's something that's sort of floated around the press over the last couple of months in relation to healthcare and emergency printing of the face shields and things like that. The question here is, how has Queensland Health or e-health been using that technology?
Yeah, so there's a COVID response, and then there's the clinical transformation response. Many of you will know that I was the former CIO at Gold Coast Health, and so I've got a good knowledge around the way technology has been used in healthcare settings. And 3D printing has been one of the technologies that we've been most excited about in terms of its ability to transform both the quality of care but also the efficiency of care delivery. For instance, if you think about dentistry, and that's a key clinical capability that we need in a hospital health service. If you have a problem with your teeth in an older person, that can delay surgery. So we actually want good dental care in Queensland Health to support our delivery of manage efficient care delivery. And one of the biggest hold-ups for us was the lead times in terms of getting prostheses, etc., developed to enable different care issues to be addressed. And 3D printing solved that problem overnight. Gold Coast, I know the oral health team at Gold Coast looked at that technology very early and worked through some use cases to solve that simple challenge of reducing the lead times it took to get patients ready for surgery. In COVID, it's the same issue. We probably, like any agile development, you get some things half right. You never can build the perfect approach straight away, and you have to be prepared to iterate and work with your partners to take feedback and build on it. And I think that's certainly what we've been seeing with our partners in industry around PPE. Is the bit of equipment, which was a really good idea, is it compliant with TGA guidelines? Is it actually protecting our clinicians in terms of the care that they have to provide to the stringent standards in terms of transmission of fluids, etc. And all of these, some of these issues are complex problems, but what's really impressed me about our clinicians is their willingness to define the problem and engage with industry and explore how how these technologies could solve the problem. And I think if you've got a willingness to engage with us in that context, knowing that it's not going to be a perfect solution right up, and we're going to want to iterate and get it right to ensure that it's safe before we deploy, then those technologies will begin to be well supported and adopted in Queensland Health.
All right. Thanks, Damien. There's another question here around the sharing of research data as a result, I guess, of not only COVID-19, but about the big uptick in technology and data around digital medicine. Just wonder if there's anything you can share about what's happening with the sharing of that data.
Yeah, so that's really relating to Horizon 3 of our digital strategy and plan. So, and just a bit of context there so that people understand. So phase 1 is get the foundations in, get some of our core systems off paper and onto a digital platform so that we're beginning to actually get some data and use it for secondary use purposes, i.e. research. Phase 2 of our digital agenda is really getting clinicians comfortable using the technologies in the clinical workflow and using the data to inform better decisions. And that's where clinical decision support tools and our Phase 2 agenda kicks in, and that's where we're right up now. This is about influencing clinical decision making around right orders, right treatments, and streamlining the use of digital technologies in the clinical workflow. And we're right in that stage now. Once we get that right, once we've got the workflows modelled and we've got a good cohort of clinicians who are comfortable using digital technologies in day-to-day clinical care, that's when we'll begin to have a good and exciting body of data available for secondary use purposes, including research. And right now, as part of our Digital Foundations program, we've been building our data lakes and scaling our infrastructure so that we're systematically ingesting all the data from our core systems of record and making it ready and available for those secondary use purposes. And we're well advanced on that agenda. We've been systematically doing IEMR, we've been systematically doing core systems, and we're about to do a really exciting piece of work with our legacy PAS solution, which is going to explore 30 years of health data and make that available in our platforms so that we begin to use that for clinical decision making, but also research purposes. So we're right there with that, and if you want to engage in that agenda, we're already working with our key university partners, so have a conversation around that. We play a key role with groups like the Digital CRC, with the eHealth Research Centre, University of Queensland, Griffith University, have all got an agenda with us in terms of driving that research agenda forward.
That's an impressive amount of data, 30 years worth of data. It'll be
Yeah,
really interesting to see what comes out of that. Another question that's come up is, what preparation do you think helped Queensland Health respond so quickly to expand the capability and capacity as a result of the peak of COVID-19 change?
I don't think it was luck. One of the things I've come in, and I'm a fairly new DDG. I started as a CEO and I got a title change halfway through. But my listening, I've spent a lot of time listening in eHealth Queensland, and one of the things that's really impressed me about the organisation is our people, and that we've invested in people, and there's a seriously talented bunch of people there. Our challenge in the digital transformation is to deploy eHealth Queensland out into the hospital and health service setting to ensure that they've good business advisors, and we've been doing that, and particularly in the last 6 months we were heavily invested in that program of work of building our relationships with our clinicians, with the management teams of our HHSs, and ensuring that we were seen as an agile partner to support our HHSs. So when our HHSs had some of these problems, we were a natural partner to bring the problem, and because we've been having this conversation around moving from traditional IT waterfall-based models to beginning to think about how we could be more agile in solving problems and delivering value sooner, we're kind of ready for it. And working with then our broader executive leadership team who had the eye on the ball, were looking at what was happening with China, engaging with our partners in the national health agenda. We were really well prepared as an organisation to support our business respond to this pandemic. And I'd like to think the relationships that we have with our partners in industry helped us to do that, because my team, particularly my executive team, do like to engage with you, do like to understand where you're at, do like to understand where you're taking your products, where your industry is going and how you can support us more effectively. And I think that's beginning to pay off, and certainly paid off for COVID.
I think that's a good point that Damien makes, that it's important for those of us who are involved in delivery of IT services. It's very much about understanding the business, understanding what those business drivers are, so that you can have a more agile approach. You can respond to things in terms of business issues that come up. And I think most very good IT shops do exactly that, understand what those challenges are for business.
Yeah, I agree, absolutely. Another question that's come through, Damien. What is one digital ICT development that has occurred in Queensland Health that you don't think would have happened without the pandemic response?
The mainstream deployment of virtual care or telehealth. Yep. Prior to COVID, we would have been having a very different conversation with our clinicians around why you can't do telehealth or what the challenge was. Who would have thought that in less than 2 weeks we would have had a virtual clinic in an emergency care department running, as the Gold Coast teams spun up very, very quickly. I think our challenge now is not to revert to the old way of working, to keep the momentum and I guess the urgency in terms of the need for transformation at front and centre of our mind, and use the good practice that we've developed to begin to work and partner better with our clients to continue this journey around transformation.
Tell us you.
Look, I think to Damien's point is very valid. How do we learned from these lessons, how do we maintain that momentum? So we've been able to react very quickly, we've been very agile, we've done things differently. How do we not let that slide back to the old ways of working? So, and I think that's a challenge not for just government, but I think that's for a challenge more broadly across industry as well, is I think there's some fundamental changes in business models there, and I think of what ways of doing things, and yep, we'll just have to maintain that focus.
I agree.
Right, another question that's just come through. What about slide 9 actually? Slide 9 talks about a thermometer, so I'm just going to go back. That one there, was it? It's hard to know exactly which slide. The question is about the using devices to check temperatures at entry points and things like that. Now, I know that's not specifically your domain, but if you have any commentary on that.
So that's been a request that's come through, and I guess part of it's an interesting one that we're actually working through at the moment in the context of healthcare workers. We want to have assurance as a system that every healthcare worker who's working in our settings is COVID safe. That we can be assured that everyone is well, and so that we don't have any outbreaks in our hospitals. That would be a challenge for us. But we've been discussing whether, and this is what you do with problem definition and ideation, is like the fastest approach there. Is it checking every temperature, or is it doing a simple screening assessment, which is about asking some simple questions right at the beginning of the day, or ensuring that every worker is asking those questions and completing the checklist about safe to work. Have you got a temperature? Have you got a sore throat? And completing that on a daily basis, so that the manager can have quick assurance on the ward that their cohort or staff are safe to provide care. And so part of our challenge is, we can throw the technology option into the melting pot, but our clinicians and our administrators are going to design a solution, or take a solution from us that best works for them in terms of the clinical workflow. In terms of screening, China did it really effectively in, I think, airports, around quickly identifying who potentially had a temperature, and so there are use cases in terms of that setting, but it's not. It goes back to what's the problem you're trying to solve, and making sure you've got understood the use case where that technology might be appropriate. And many of our HHSs are exploring screening technologies as a way of beginning to manage entries into an emergency department, etc.
It's a hard one.
I think that's a challenge for all workplaces as we return to the offices. How do we make sure that we've got that safe workplace and those things in place? And it's good to hear in terms of that's a strong focus in terms of having a safe workplace. Got a bit of a personal bias there. I have a young daughter who's a doctor, a young doctor in emergency department. So it's important that we're looking at the welfare of our workers.
Yeah, absolutely.
Yeah, I completely agree. On a different topic, this is a very long question. I'm just trying to shorten it. A lot of the questions we get are around in the procurement, because there's partners in technology and procurement. How is Queensland Health going engaging with SMEs?
Pretty good. Those who know me will know that I've done a Partners in Technology presentation probably about 2 years ago, I think it was, where I talked about the innovation program that I'd stood up at Gold Coast. And one of the deliberate intents of that program was to make sure that we were beginning to, with our clinicians, think about agile delivery of technology, but with small to medium enterprise in Queensland. And that was, we set up a digital engagement process where we could bring our clinicians together with small to medium enterprises and help them connect. And I'm supercharging that agenda in Queensland Health through eHealth Queensland, particularly in terms of our innovation hub, which we've established in the precinct in the Valley, and that is there designed specifically with that end in mind, to get good use cases from our clinicians, get those clinicians in a room, provide the opportunities for small to medium enterprise to begin to work alongside our clinicians to think about how their technologies or opportunities might solve those use cases and take them through an agile development process. Doesn't mean to say we'll go for everything, but at least get the conversation started and I'll get, if you like, the innovation juices flowing, and that's what we really want to create. So if you want to know more about that agenda, and particularly if you're small to medium enterprise and you want to engage with Queensland Health, contact our innovation team through eHealth Queensland, and we'll provide the details of that address. They did give me a web address to give you, but I'm not going to remember it off the top of my head, so we'll give that. Make sure that's up on the website after the session.
We can absolutely do that.
Certainly I know that Queensland Health's been very active in that space. A year or two ago we did have within government a thing called the Testing Within Government program, which was aimed at providing opportunities for SMEs to provide innovative solutions to the government. And I know that Health was involved back in those days. And I know one of my staff who was driving that process actually now works in Damien's Innovation Centre to help drive that forward, so yes.
Yeah, and I've just been working through budgets for next year, which are pretty tight, but I'm making sure that continues to be a priority for next year.
All right. Probably the next step up, I guess, from that question is beyond the SMEs to the, I guess, the slightly larger but not international organisations. I think, what's the category for an SME again? 50 staff?
No, it's slightly bigger than that. I think it's 200.
Yes, that's right. And so for those ones that are, I guess, between 200 and internationally sized, is there any different change in engagement with eHealth, Queensland Health, with those suppliers?
So engagement with industry is a priority. We've got to be connected. Right at the moment, I would say a lot of the approaches are coming straight through to me, and what we're trying to do within our executive team is work as a team. So I won't have the capacity in the time to engage with all parts of the industry, but we're making sure within our leadership team that we understand where industry is at, and that we're each got a portfolio and supporting their entry or conversation with Queensland Health, including not only eHealth Queensland but our partners in the hospital and health services, the 16 other CAOs who are working and collaborating with us on this agenda. So it doesn't really matter to me whether you're big or small. You've got a point of view. You've potentially got an offering that is going to support us on the transformation agenda. We might not be able to use it straight away, but we've got to be informed about where you're going and what the opportunity is, particularly in terms of as we begin to move off legacy infrastructure and we begin to move on to digital platforms and creating that digital platform ecosystem.
Any thoughts? Well, that's actually the end of the questions for today.
Thanks,
apologise to our viewers and to you both for the interruptions that we've had. All of this event is summarised and kept as a recording. Normally the recordings will have no audio issues, so please keep your eyes on the subsequent release of the full recording. And unless you'd like any further closing comments, we can wrap it up.
Thank you for joining us today. Again, as Mark said, it's unfortunately had a few technical issues, but we'll check out the recording on the website. Again, I'd like to thank Damien very much for coming along and sharing his insights and what's happening within Queensland Health. And Mark, thank you for moderating this question. So thank you everyone. Stay safe.
Thanks.
Thank you.